Now, we've seen significant, the PRO, significant improvement, especially one of the biggest things was pain, right? It's the improvement of pain. There was improvement of dyspnea. These are some of the highlights. There's improvement of emotional distress and instability, and across the board, across all the PRO dimensions, there has been improvement in the camizestrant group. And a lot of people were worried about, if you added this agent earlier on, you're going to have a lot of cumulative toxicity. Patients just did absolutely better. Even the discontinuation rates were less than 2%, across both arms, really. So all in all, when it comes to their PROs and how they did, despite these patients receiving overall more treatments, they actually did much better because you intervened earlier. And I want to throw a plug in here about, the way I think about these particular interventions is sort of like how we recommend in lung cancer patients. We have this famous palliative care study, right? Introduce palliative care earlier for your lung cancer patients. I think any agent that can debulk the tumor and keep the tumor's, objective response high and the disease burden low, even if, and I will defend that opinion, even if you did not get a BFS progression, you're getting quality of life improvement.
100%.
And that's what patients care about.
That's the goal.
Dr. Peter Schmidt once said, I will take objective response decrease over, more important to me on a BFS, because that's what patients actually 100%. Feel. So going to camizestrant, and I think that this is, again, another very important selling point, is, being able to make these patients treble, overall the typical amount of, from the start of their diagnosis until, their progression, while having them having a much better quality of life.
That was so exciting. You didn't double the quality of life. You didn't triple, you quadrupled it. If you look at the median time to deterioration, it improved by 4 folds.
Yep.
This is, for me, by itself. There is a lot of other stuff to love about that study, but this by itself validates what we're trying to do. We're trying to keep our patient healthy so they can enjoy their life as long as possible. And this is something by itself, this metric by itself, for me, I wish it was the primary endpoint. That's how much I love this data. Because you're right, pain is devastating. Pain in the metastatic setting is devastating, and patients have to deal with it, cancer-associated pain. I'm sure all our community oncologists listening to us, this is something you have to deal with. You're a pain doctor on top of being an oncologist. You are significantly reducing pain on that study. Hopefully that, with further data, we're gonna learn that this is less fractures in the bones and other stuff. So this is super exciting. And like you said, discontinuation rate is very, very, very low, meaning patients are tolerating it well, are doing well on this therapy.